We are back on Morning Line. Thanks for joining us. With us is Dr. Calvin Smith from over at Meharry Medical College, taking your calls and questions. Good morning, doctor. Appreciate you being on.
Thanks for having me.
Thank you, sir. Yeah, we have some folks that waited through the break and several folks following us on Facebook at newschannel5.com. One question here, and doctor, can you explain why it is the swab, as you said, it does go up a ways in the nose. It's uncomfortable, doesn't really hurt, but is it not possible to take a swab by going through the mouth? It has to be the nose?
Yeah, it has to be the nose, and the reason why it's going to be it's because it can cause a gag reflex where the virus type likes to live. If we were to go through the mouth, we would actually trigger that gag reflex. So going through the nose hits it where it lives without causing you to have that violent reaction. It's not comfortable where it is now, but it definitely would be a lot less comfortable for us as well as the patients that way.
Gotcha. And one other question before we get to the phone calls is I've seen several reports that there are some concerns as more widespread testing occurs using the swabs that there may be a shortage of swabs. My understanding is that there's just one company in this country that makes them up in the Northeast, and then another company in Europe is where they come from. And have you heard anything along those lines about the potential shortage of swabs as they start expanding it to try to get to as many Americans as possible?
Yeah, that's one thing that we've been very concerned with, especially at our sites. Again, comfort being a concern for us. There's some videos of some people having some very rigid swabs done. And, we've been trying to use the comfortable ones. But, yes, we are concerned that we'll run out of them at some point in time. Right now, it appears that our supply is pretty plentiful. We've been getting restocked from the city labs without any issue whatsoever at this point in time. But if the production doesn't increase, we probably would run into a shortage.
And that's interesting. I hadn't heard that. There are different types of swabs. And when you say comfortable, I know when they did the swab with me, when you see it, it's not really cotton on the end, by the way. I understand it's like latex or something, and it's kind of springy. It's not a stiff, like, wooden swab that doesn't bend. So it gently goes up there. As again, it's not horrible having it done. It's not comfortable. But that's what you mean by the comfortable swabs, the ones that bend a bit?
That's correct, and I'm using the word comfort. What we usually tell patients is it feels like you're getting a little bit of salty water up your nose. That's been about the most accurate description of it. It'll make your eyes water a little bit, but I'm having flashbacks to having mine done. That's exactly how I feel.
Gotcha. All right, let's take a phone call or two for you, and we'll start off with Barry. Barry, good morning. Do you have a question or comment, Barry? Hi, Barry.
Hey, hello.
Good morning. Go ahead, sir.
The question is, why are they making such a big deal on these tests? I took a test and I came back negative, but does not mean that I can't catch it the following day. So all the numbers, the projected numbers, and all the numbers that they're showing on TV and how many cases we have, does it really matter? Mm-hmm. On how many cases we have that they're reporting on? I could have the virus tomorrow.
Mm-hmm. I hear you. That's kind of what I was saying. Go ahead, sir.
Yeah, I agree with you, Barry. And Barry, I'm happy that your test came back negative because we know that you don't have it. And so you're right. You could potentially convert over to a positive case if you're exposed to people. The biggest thing is to have more people get tested and to isolate the ones that actually are positive. The people that have a negative test, it's reassuring for them, yes, but it's not as important from a statistical standpoint, you're right, as the people that have a positive test. And the numbers of positives, we're at 1.3 million in the United States right now of people that have had a positive test. So it's not something insignificant. This is a very, very, very high number comparatively compared to other viruses. But we want to test as many possible people to see if we have positives. And having a negative is reassuring, but I think it should reassure you to continue to do the things that you've been doing as far as social distancing, staying away from people who potentially could have symptoms, wearing a mask in public, and encouraging others to wear masks.
Yeah, and I'm like with Barry. I went through the same process, came back negative, and I realize now, by today, maybe I could have it again. But really, I guess your point is, and what my point was going to get it, and maybe for Barry, would be that had it come back positive and we felt fine, that would have meant we're asymptomatic and we potentially could spread it to someone else. And so by finding that positive then from the testing, I can know I have to isolate, not come to work here, stay home, make sure I stay away from people, beyond what we're being asked to do right now with social distancing, correct?
That's exactly it. That's exactly it.
Okay, that makes sense. We have a couple other people here just asking with regard to the masks, and Kimberly wants to know, how often should we be washing our masks every time we wear them? Now, I've got a cloth one like this that I'm going to use maybe today, and I will dispose of it. Okay, and this is a just cheap. I'm sorry, it's not. I don't know what it is. It's plastic, but I have some cloth ones that I can reuse. If I wear that and I'm just keeping my distancing, do I need to wash it every day when I get home, or can you wear it 2 or 3 days in a row if you're not around a bunch of people? How would you do it?
So the idea behind the mask is actually to prevent people who actually have it from spreading it. If I wear a mask, for instance, and I don't have it, and you don't wear a mask and you do have it, my risk of getting it from you is still very high. Okay, the people that have the mask and have the disease, it really cuts down on them spreading it out to other people. Now, as far as the comfort of, it really depends on the patient, or on you, and how often you feel comfortable washing it. If you are a heavy secretor, things of that nature, you probably want to wash it every day. If you are somebody that, if you're not really that big of a deep breather, things like that, you're probably not soiling it to the extent that you need to wash it every day. But every 2 to 3 days is probably reasonable.
Okay. The point is then that we're wearing masks not so much to protect us, even though it may provide a little protection. It's more to keep us from potentially spreading it to someone else. All right, says the thinking on that. And as far as getting the virus, and we haven't touched on this, you're not doing the antibody test, but is it, of your experience and what you've seen at this early stage, do you think there's a chance if someone does get it and recovers, they will have some level of immunity or not?
Based on the history of this particular type of virus, yeah, it's a pretty high likelihood that once you have had the virus, that you'll be immune to it going forward. That was the case with SARS. That was the case with MERS. And this is following in kind of a very similar pattern, although it is way more contagious.
Gotcha. All right, let's go next to Diane. Diane, good morning. Do you have a question for the doctor?
Yes, this is Diane. Good morning, gentlemen.
Morning.
Good morning, Diane.
The first thing that I want to say was with the asymptomatic people, how long does that actually stay in your body?
Okay.
Yeah.
So we're finding...
Yeah, that's a good question.
We're finding that most people who are asymptomatic carriers will have the virus shedding for about 7 to 10 days. So what we've been advising people is to, if you are an asymptomatic carrier, to quarantine yourself for about 7 days or so. And generally around that time, you should stop shedding the virus.
I know we don't have too much more time with you. You're a busy guy. But before we go on this, that just hits again toward the vast range of cases that we see. I mean, there can be someone who's a carrier for 6, 7 days, asymptomatic, but they've got it. And they really have no problem. Hopefully they don't spread it, but after 6, 7 days, they're back to normal and feeling fine. And there's other people, as we said, that in a matter of days are dying. I mean, why the difference, especially sometimes this occurring in folks that don't necessarily have, an immunity that's compromised? Is it just genetic? Why is it with some, it's lights out, and others, they don't even know they have it, and they recover really quickly?
Nick, I'll be completely honest with you. We don't know at this point. If I had to answer that, I'd be a very famous, popular guy. We just don't know, and that's the scariest thing about this thing, and that's why we as medical practitioners are taking it so seriously, is because it's literally like a crapshoot. We don't know who will have the most severe symptoms at this point in time. We haven't been able to isolate, you have high blood pressure, you have diabetes, and so you're going to have a severe course of this. That's not how it works, and we still don't know. And it's confusing, and it's frustrating, and it's scary. But we're managing to find a way to go through this process, and social distancing has been working. So that's what I'm in favor of.
Well, listen, social distancing and go get yourself tested if you suspect you have some issues. And again, it's just to protect and keep it from spreading is what it's all about. And over at Meharry, you guys do a great job. And I know you're busy right now, Dr. Smith, but I know we'll be seeing you this afternoon at noon for Ask Nick. I look forward to you joining us then. So we'll try to take more questions now after you leave us for a bit, but then they can call back at noon. So we'll see you then, sir. All right?
Absolutely. I enjoyed it, Nick. Thanks.
Thank you for your time. All right, so we'll take a break. When we come back, if you're on hold, stay there. We'll still get to some of your questions. Some of these we can maybe even try to text him to get answers if I can't answer it for you. And also, if you have any questions or comments, go ahead and message us right now on Facebook, and we'll see if we get to those. As we've got the rest of the program now to answer questions along the lines of what we were just talking about. And if some of you have questions about the stimulus payments or unemployment, but especially stimulus payments, I can try to answer that for you, including telling you why there's a very important deadline today you need to know about if you have not yet received that payment. So we'll be back with more on Morning Line right after this.
The Storm 5 weather update. For weather on the go, download the Storm Shield app.
Hi everyone, I'm News Channel 5 meteorologist Leland Statham. Around the Mid-South today, a warm front pushing